Hi there, I'm Dr. Cory Rice, and we're going to do a brief patient seminar tonight so that you know what Biote is about and what your provider has learned as it relates to Biote and how to improve your quality of life. So what are hormones and why are they important? What is this idea of hormonal imbalance and hormonal loss? What do you need to know? Who can you trust? And what can you potentially do? All of this we're going to get into today. So what are hormones? Chemical messengers. They're made by glands within the body and they just talk to the body. They talk to the cells talk to the organs, and ultimately they work in this nice lock and key fashion to help you and to help optimize different areas of your body and different aspects of your life. So at the end of the day, do we age because we lose our hormones? Or do we lose our hormones because we age? That's what we're going to sort of go through this evening. So do you feel like this? Do you feel down and depressed and fatigued and just unmotivated and just foggy? Is that you? Or are you this? Do you feel vibrant? Do you feel energetic? Are you sleeping well? Is your sense of well-being up? Which one of these do you want to feel like? I know my patient's answers, and I probably know your answer too. So what about some of this stuff? Do any of you have this afternoon fatigue? You're going to pick up your kids and you come home and you're just tired. You want to lay down. You come home from work. All you want to do is lay on the couch. Any of that sound familiar? Or what about just moody, right? Up and down and just irritable and short-fused and anxious and just sleepy, patchy sleep, not sleeping well, all of those things. You're forgetful. You walk into a room, you don't remember why you're there. You see a face, you don't remember who that is. You forget where you put your car keys. Does any of that sound familiar to you? What about just that fogginess you feel in your brain where you just you're not really clicking right? Do you get hot throughout the day where you're just sitting there and just randomly, you just feel really hot and then it goes away and then it comes back and it's completely random? Or at night, are you throwing the sheets off? Are you drenching your clothes? Are you actually having to change your clothes? Does any of that sound familiar? Or is the scale keep going up despite all that you're doing? Do you feel like you're less firm and you're just a little more fluffy? Is the weight really a struggle no matter what you're doing? How about getting up and having joint pains or hand aches or just feeling stiff in the morning? Is any of that sound familiar? Or a lesser thought about thing, what if you're incontinent of urine? Are you losing any urine throughout the day if you sneeze or you cough or you laugh? Are you getting headaches that may turn into migraines? How's your interest in intimacy? Is that low? Is the quality of the experience low? If any of that sounds familiar, you gotta listen up because you're gonna have solutions today. So what is this Biote method? What is Biote? So Biote looks at hormones. It looks at hormones in a very advanced way. It's looking at hormones in a way that individualized therapy to you specifically as the patient. So it's looking at testosterone, estrogen in females as well. Sometimes it's looking at progesterone. What about thyroid? We've all heard about thyroid. Thyroid controls a lot of things in the body. So sometimes as we age, our thyroid isn't optimized. So your provider at Biote has been trained in advanced ways of interpreting labs and giving you options on how to fix that thyroid. What about the idea of supplements, right? There's certain micronutrients like vitamin D and probiotics and all these things that are really important to your health. So your provider's also gone through some advanced training to help you understand which particular nutrients you need to take more of and which maybe you don't. All of those things go into making the Biote method what it is. And that whole method is really based off years and years and years of clinical experience among several different providers. And so all of that together leads to our ability to be able to support you the best way we know how to. So what is andropause? I've heard of menopause. Well, andropause is male menopause or manopause, right? So as men start aging, specifically, men start losing 1 to 3% of testosterone annually, starting at the age of 30, right? And so as they go into their 30s, into their 40s, they're losing it quickly. And what we're gonna show you is as men start losing testosterone, their blood sugar goes up, which means their diabetic risk goes up. Their blood pressure goes up. All of these things, including sleep apnea, all of that, as well as other chronic diseases, can absolutely be part of andropause. And all of that can lead towards heart disease. And unfortunately, both in men and women, low testosterone is absolutely underdiagnosed. That's where your practitioner is different, and that's what you're going to talk to them about. So testosterone, facts about testosterone. At the end of the day, testosterone replacement in men and women give major symptom relief, and it protects the bones, the brain, the breast, the heart, and honestly, it protects your relationships. I didn't go into healthcare to do couples therapy, but I'll tell you this, through all of the Biote that I do at my practice, I am absolutely doing couples therapy now, and it's so rewarding because you're helping these men, these women, and their relationships. So testosterone, it's present in both men and women. Lots of testosterone in men, smaller amounts in women. I've told you how men lose it. What about you, ladies? What if I told you that at the age of 20, you have a certain amount of testosterone? By the time you get to age 40, you've lost upwards of half of that, sometimes more. So you lose testosterone very quickly through your 30s and into your 40s. There's certain disease states that are linked to different based on your testosterone level, you can have risks for these disease states, right? So you can have bad cholesterol. Bad cholesterol can lead to heart disease. You can have high blood pressure and abdominal obesity and lack of muscle. Lack of muscle leads to slower metabolism. Slower metabolism means you don't exercise well. So based upon certain cutoffs of a male's level of testosterone, they can have some of these risks, which includes dementia and prostate cancer, diabetes and heart disease and fatigue and all of these things. So it's a very important deal. What about positive effects of this? So the idea is, you've probably heard the term bioidentical. We like to use the term human identical. The hormones we use at Biote and your provider is going to use in you if you're a candidate for this therapy is human identical. It's identical to what you've been producing your entire natural life. So the positive effects for men and women of testosterone use, better energy, overall well-being is increased, less anxiety, less depression, less memory loss, better focus, enhanced sex drive, enhanced experience of intimacy. Testosterone protects the breast as well as the prostate. It helps with brain health, heart health, bone health, ultimately leading to increased muscle strength. When you increase muscle mass, you decrease fat mass, you increase metabolism, and you lose weight. It's beautiful. All of those things also help to lower cholesterol. So in females, menopause, unfortunately, every 14 seconds, a woman in this country is hitting menopause. That's 6,000 women a day, and that's over 2 million a year. Perimenopause, so premenopause, perimenopause, postmenopause. Perimenopause can take up to 15 years. That's part of why Biote has been so successful for our ladies, is it helps you transition through premenopause to perimenopause through hormone balancing into that full-blown menopause. So it affects women in more ways than they actually realize. And a lot of women, they don't really ever get over or get through menopause. It's something that it can last for quite a while, which is why, again, timing is everything as we try to balance these hormones. So heart disease, it makes sense that as you lose your hormones, if they're so protective to the heart, that you can have a higher risk of heart disease. In fact, as women become postmenopausal, 1 in 3 will die of a heart attack. That makes sense. But what about these premenopausal women? Women who are still making hormones. 1 in 7 of them will die of a heart attack. And why is that? Ask your provider, but the reason is testosterone is dropping, thyroid is dropping, and we recommend optimization of both as early as you can have it so that we can protect against progression of that particular condition. What about estrogen? Estrogen, you have receptors to estrogen all over the body. Men have estrogen, women have estrogen. Large amounts of estrogen in women, small amounts in men. There's over 400 functions in the body of estrogen. It helps control how hot you are, so hot flashes. It helps your bones, your achiness, your memory. Ladies, how about aesthetic appearance, right? Women who have their estrogen optimized, that are candidates for estrogen, they have better collagen, they have better elasticity, so they look more youthful, right? They look younger. That's a great thing. It also helps your memory. It helps your neurotransmitters that make you happy. So your serotonin, your dopamine. The other thing about estrogen in women is it lubricates you. So if you have eyes that get dry as you get older, a lot of women have that. A lot of times that's from your lack of estrogen. Or vaginal dryness, or just feeling stiff as you get up. Estrogen helps to lubricate all of that. So the positive effects of human identical estrogen include all these things: collagen, hot flashes, bones, and bone strength, protects the bone, brain, breast, heart, memory, all of this. It can help fix your cholesterol panel as well. So what about hormone therapy? You have options as patients. You have synthetic options, which are not natural to the body, and then you have these human identical options. So we won't talk much about the synthetic options. I don't know about you, but my patients like things natural. They like the term natural. So we're gonna talk about the natural therapy, which is on the right side. So you've got oral options, you've got patches, you've got creams, you've got pellets. There are options on the natural side, and I'll double click on that right now. We don't like to give a lot of oral hormones because as you swallow something orally, you lose a lot of its effects because it has to be metabolized through the liver. So we've noticed it just doesn't work well. With creams or patches, half of women, roughly, don't even absorb a patch when you put it on their body. And a lot of times when I've used patches on my ladies, they get a little red irritation or rash around it and they just don't like it. So what about creams? Well, you can rub creams on the body, but the problem there is it's also hard to absorb that and penetrate the skin and get good levels of hormones. Plus, you don't want to transfer that cream onto your spouse or loved one, or a child, or an animal. So there's limitations to creams. And what about injections? Well, injections, if you do them correctly, you're doing a couple of these shots a week. 2 times 52 is 104. That's a lot of injections. That's a lot of needles. The other part of injectable testosterone is you get this high amount, low amount, high amount, low amount. It creates a roller coaster. And I don't know about you, but my female patients, my male patients, they don't want to live on this emotional roller coaster. And if you're doing shots, you've got to follow labs more closely because of potential side effects. Now, with pellets are implanted, little tiny pellets are implanted under the skin, and they stay there in women for 3 to 4 months, and in men, 4 to 6 months or so. And they give you consistent release of hormone, which mimics exactly how our hormones work in our body and have worked in our body. There can be slight pain at the site of insertion. You can have a little bit of needing to take restrictions on your activity, but my patients report to me over and over again how convenient the pellets are because it just makes it so simple for them. They don't have to remember a prescription. They don't have to go to the mailbox. They don't have to remember a shot. They don't have to go to the doctor's office to get it filled. It's a very convenient mode of delivery. So again, on the injectable side of things, you've just got an uneven absorption. You've got to follow more lab levels for potential side effects, and it's just a lot of shots. And at the end of the day, it's synthetic. So on hormone pellets, the ultimate idea is these are plant-derived natural compounds. They're identical to what we have all been producing. My patients love that. They love the idea they're on plant-based something and something their body recognizes. And at the end of the day, this has been around a long time. We can individualize the dosing, and it's basically just convenient and hassle-free for you. And that steady stream of hormone in the blood is really, really nice because it's easy for your doctor to follow your progress and your hormone levels. So pellets have been around since the 30s. The first patient to have pellets implanted were in 1939. It was quoted in 39 and 49, pellets were already being published. So these are therapies that have been around for 80 plus years. This is definitely not something new. So breast health, right? There's a lot of misconceptions out there. Your provider has been very well versed in breast health and how pellets can actually impact breast health very favorably. I have a lot of breast cancer survivors that I still put on testosterone pellets and they love it. It changes their quality of life. If you have questions about that specifically, please talk to your provider. Bone health. As we all age, we lose our bone health and we have a higher risk of osteopenia or osteoporosis. Pellets have absolutely been shown to affect bone health. In this particular study, it was compared against patches and oral therapy, and pellets blew the other 2 modes of administration out of the water. There was a 4-fold increase in bone density by using pellets versus the other 2 options. So osteoporosis, we can absolutely address, and your provider can talk to you more about that. What about brain health? We have to absolutely be cognizant of dementia and Alzheimer's and things like this. Women, 8 to 1 over men. What's so important, ladies, is women on estrogen are 50% less likely to develop Alzheimer's disease. How great is that? Everything is about timing. Your provider will tell you it is not us waiting until you get older to optimize you and assess your hormones. We want to do this as young as we can. The name of the game is prevention and early detection. Same thing with Alzheimer's. Heart health. The number one killer of men and women is heart disease in this country. So in ladies, as you go on to estrogen, specifically pellets, the studies have shown it helps to raise the good cholesterol, lower the bad cholesterol. All of that, you also lose fat. When you lose fat, you build lean muscle. When you build lean muscle, you have a better metabolism. When you have a better metabolism, everything gets better. So you can help avoid heart issues as you age. Men, same thing. It helps to raise the good cholesterol, lower the bad cholesterol, and you get marked reduction in fat mass, and you get increased lean body mass, and all of that is very, very favorable on your heart. So in women and men, this is a great preventer of developing heart disease later. And again, that's the number one killer of men and women in this country. I'm gonna leave you with some key takeaways. I have done seminars like this for thousands of patients, and it's just so awesome when you guys come out and you have questions and comments and dialogue amongst each other and with your clinic and your provider. That's really where things really start to make sense. So the key takeaways from today: hormone imbalance can occur in men and women at any age, young to old. At Biote, your provider is trained. There is no cutoff point. So you stay on this therapy as long as you want those benefits. That's the bottom line. Hormone balance is also not a one-size-fits-all approach. Everything is individual, as it should be. Patients like to be listened to. They want to know that what you're recommending for them is not the same thing you're recommending for all your patients. But it's truly looking at that idea of precision and precise medicine and focusing individually on your needs, based on your symptoms, based on your specific labs. Patients love that individualized nature of Biote. And then what about those labs, right? Normal labs may not be optimal. So reference ranges may not be optimal ranges. Your provider has been trained and certified on advanced ways of ordering and interpreting these labs so that they know how to put your dose at that individual side of things so that you can get the best results, the best outcomes, and those outcomes lead to a better quality of life, bottom line. So if you want to learn more, visit your Biote certified provider today. Thank you again for joining me today. Have a great one.